Hello and welcome to another episode of Younger by the Minute. I'm your host, Jamie Spicer, and I'm always here with my other lovely host.
Jennifer Spicer, and I am so excited because we are able to spotlight somebody that is very near and dear to our hearts. As many of you guys know, we own a practice called Precision, which focuses on aesthetics, wellness, fitness, medicine, all the things. Rachel has been with us since 2019. This is the amazing Rachel Werner. She's a nurse practitioner and an aesthetic provider. And truly, Rachel, you're somebody that embodies what it means to commit, to grow, and to transform. From the moment we met, you literally drove hours to come and shadow to learn your craft. And the hunger that you have is rare. And it's exactly why you've become such an integral part of Precision. Since becoming an aesthetic provider in 2020, you have not only elevated your own skill set, but you have gone above and beyond to complete your nurse practitioner degree this year. And that's what makes your story even more inspiring. And the way that you're bringing your personal life story, which we'll get into what you do and your reason why, is a part of what Precision's all about, especially with your passion for children, pediatrics,
Yeah.
and your daughter. So we'll get into it. Welcome to the show.
Thank you guys for having me.
Great to have you on here
Thank you.
and to work next to you every day.
Right, exactly.
Rachel, let's start with who you are and how you would describe what you do at Precision.
So I'm an aesthetic nurse practitioner now, which I would love to say that. But I offer neuromodulators, derma fillers. We do a lot of regenerative services, of course, IV therapy. And then, of course, now I get to be a part of the functional medicine team. Well, I've been a part of it for a minute, but now I get to be like full on as a provider, going over comprehensive blood work. It's been really awesome to do all those things. So.
And it's been great to see you grow and get better and better. And I'm really excited to talk about your journey, not only within the walls of Precision, but outside of it. So,
Yeah. Before we get into there, tell us a little bit more, like take us back to 2019.
Yeah.
What made you want to get into aesthetics and what compelled you to feel like, okay, like if I'm going to put all this work in, how you knew that you were going to have the return on investment?
So I think obviously, aesthetics is not easy to get into. And I was doing I don't want to say normal nursing, but bedside nursing. And I just never felt like fulfilled in that regard. And I kept telling my husband, I was like, I'm ready to like lock in. I want to do this. But we were living in Champaign, Illinois, and there was like two places up there. And they were like, we want at least a year, 2 years experience. How do you get experience if nobody will hire you? So then I started looking into, okay, like how do I get training? Well, there's weekend courses and then a week course. And for me, like that just honestly felt extremely unacceptable. I wanted to find somebody that would take me under their wing, willing to do so. And I was willing to do whatever it took because I wanted to find a provider that I could trust and that really like ignited more of that passion in me. And I found you.
But great.
yeah. No, you're right. It's almost kind of like funny, like when you start up a company, nobody will loan you money, right? And so how are you supposed to start a company?
Right.
But then after you're open, then everybody wants to loan you money.
Right.
But and what you guys doing, like even with the dietitians and the trainers, we're all in a business where it's such a saturated market. So it is hard to get your name out there. It is hard to grow a book of business. You got to have the wherewithal to weather those storms, to have the confidence that you will one day have the book of business you desire, provide the income that you want, have the lifestyle you want. But just like with everything from a hairstylist to a life insurance agent to anybody manages money, it's a hard climb. And I really applaud you for your wherewithal and weathering those storms and, believing in yourself first and foremost, but also thankful that you're believing in Precision to help you get to where you want to be at.
Yeah.
No, I think you hit the nail on the head. Like a lot of people think like aesthetics or personal training or the medical weight loss that we offer or the hormone replacement therapy that we offer is plug and play medicine. And it's really not. And you've seen that firsthand. And so how did you approach learning or how do you feel like is the best way to approach learning in these crafts?
Well, as you know, in undergrad, they don't teach this kind of nursing at all. And even when I just completed my master's, they don't teach this. So it's a lot of self teaching and finding someone who's willing to also help guide you. Cause I learn best like being shown something or like learning it and then hands on and repeating that. It's not like that's why I don't love these like weekend courses or things like that. It's just not safe. This is a big deal. And so you have to, it's just a continuum. You have to keep
Hmm.
learning.
Mhm.
So,
Yeah. I was going to say it's almost just like giving someone a tattoo gun and it's an over weekend course, and then you're going to go get this permanent tattoo on your body, and it can look like something that came out of the jail. It can look okay, or it's one of those tattoos that you're like, wow,
yeah.
like that is an incredible who did that work, and the person who did that work didn't. It wasn't just done overnight.
Right.
It was continuing education. It was continuing to learn from other people. It was just a constant reinvestment in yourself. It all takes time.
Yeah.
What do you think the most rewarding part of all that is? Because it's definitely, there's a lot that goes into it, a lot of effort, a lot of time, a lot of patience. What do you think is the most rewarding part of being an aesthetic provider, more specifically?
Yeah, I think one, I mean, and I know that you can attest to this too, but patients are pretty vulnerable in those situations. They're putting a lot of money and they're putting out there like things that make them insecure. So I really felt rewarded in the sense that patients, they kind of become like my friends or family. Like we
Mhm.
text with each other and check in on each other, and they'll tell me, they'll literally cry and be like, you make me feel so beautiful and heard. And that, I mean, you cannot put a price tag on that.
Mhm.
But what you were saying is like you can't do something overnight. And so I do struggle with like imposter syndrome because this is a saturated market. And I don't say that in a negative way. It's just that there's a lot of people that wanted to get into this field. And it's learning to not it's hard to not beat yourself up and compare yourself with social media and how other providers are doing things. And I think having the support at Precision, because it's such a family, and you guys push for education and help us grow and learn, and that has helped me stay in the game and not give up at just seeing that reward.
Absolutely. Because as we've been all alluding to, and what we're going to get into, which is just another way for God to really level you up when
Mhm.
in regards to working on that imposter syndrome, we're like pioneers in a sense. Like,
Mhm.
not saying that we're the first to do these things, but there isn't a roadmap. It isn't like, okay, we're going to go into cardiology and we're going to learn how to read, strips and all that stuff. Like, there's a million ways to do it right. There's a million ways to do it wrong. So it's
Yep.
like sometimes deciphering which way is the right way and making sure that we're using the most up to date information. So go ahead.
I was going to say the one thing that me and you just talked about this from the one conference that you came back from, and I was like really complimenting you on how well you did and everything. I think sometimes people get caught up in the tenure on like how long someone's been doing something. They'll look at someone like, well, they have only been doing it 5 years. That person's been doing it for 10 years.
Mhm.
Well, maybe that person that's only been doing it 5 years has been exposed to way more because they invested more in education. They have been around more other top injectors and learned tips and tricks and about the craft that the person at 10 years haven't, because they haven't put in the time, they haven't put in the education,
Yeah.
they haven't been exposed to the right type of people. I was even talking to Hannah, our dietitian, about the same thing. Yeah, I told her to go challenge her to like go talk to some of the people you graduated with that are working more into just the
Traditional.
corporate traditional hospitals, and compare your knowledge of what you know from working at Precision, because she's been exposed to way more working through us because of the medicine team
Mhm.
and because of who our medical director is and the way that we do things. And she's like, you're absolutely right for that.
Well, no, you're right, because into the customer, the consumer, the patient, whatever name you want to give that person that's coming in to seek a service from us, they don't know how to decipher that. Like, for example, the laws changed between Missouri
Mhm.
and Florida. That was the real reason why I wanted to get my nurse practitioner degree,
Mhm.
was because I knew that one day I would want to practice in states that required that of me. But that doesn't mean that it helped me learn anything more about aesthetics.
Mm-mm.
Turns out God had a different path, and now I have my why of why we do
Mhm.
medicine, and we're going to get into your why.
Mhm.
And so it's like that's what I hope we really gain awareness. That's why we're doing these podcasts and trying to educate on social media, because people don't know, and there's no one that's truly at fault, but like
Yeah.
it's all luck of the draw. For example, somebody might have made the right connection to learn from the right person. That's just, like, look at meeting the
Yeah.
people that we've met at
Yeah.
these mirth summits. Like, it's been luck, we can
Mhm.
been able to just make these connections along the way. And I do think that, yes, you have to learn a skill set,
Mhm.
but the ultimate thing is especially if you believe in God, God gives us everything that we have to then be able to do something good with it,
Mhm.
Yeah.
no matter how hard it might be. And so if you have this desire, if you have these things that are given to you, then it's up to us to figure out, okay, what's God's next step? And you just have to trust that those next people or whoever we need are going to be there.
Yep.
So, with that being said, this year you graduated as a nurse practitioner, which is a huge milestone. And I know how hard it is.
Thank you.
I think you both have more gray hair from it. But,
Yes.
but what inspired you to take the next step? Why did you want to become a nurse practitioner?
Yeah, that one, you know, I always get emotional about it, but that one I love to learn. So that's like always going to be something. But obviously, when I got my aesthetics job with you, I was like, I'm good. Like, this is what I want.
Mm.
It was until, having Gianna and her story, like her diagnosis changed everything for me because I realized something was happening to her that I needed to figure out why. And that when you're a mom or you love something so much, it will change every cell in your being to like fight for them. And so, like speaking on God, and I'll never forget, I was driving, and it's not even a special place that I was driving, but I was listening to a worship song, and I hadn't listened to worship songs in a minute, and I was listening, and I literally, people talk about hearing God, and I'm always like, well, so, like, is it a voice? Like, what
Right.
do you hear? But it was so clear. And he just gave me this clarity. And he was like, you have been on this path, like every step in your journey. I mean, I started as a patient care tech, which is a fancy name for a CNA, and then student nurse tech, then a nurse, and now a nurse. He was like, everything in your life has led you here to help your daughter and help others. And
Hmm.
I felt so compelled. I was like, I went home and I was like, told my husband, I said, I have to go back to school. Like, I have to do this. There's something more to be like discovered and help kids like her.
Mhm.
So,
Well, I know we're 2 days out. I'm going to cry. We're two
yeah,
days out from her 5-year
yeah,
birthday.
yeah,
Jamie, you have to talk.
yeah.
So, tell us about Gianna's story if you're
Yeah.
open to share it.
So when you're pregnant, obviously you have all these visions of what you see for your family and your child. And there was nothing in her in my like as far as like every test that we did, there was nothing that stood out that I had a rough pregnancy, but nothing with her was wrong. And I had her and she was perfect and she was developing normally. And it was just like a sheet, like a curtain was drawn and she was diagnosed severely autistic. And that no matter who you are, that will change your life. It'll change the trajectory of your family. It can really rock your family. Her, sh- she is the most beautiful, loving child in her world. It has to probably feel really peaceful and beautiful, but I still want her to have everything in life and experience a lot of things that I don't know if she can yet. And that there's nothing about her story that wouldn't change everything that you do for somebody. It's helped me dig so much deeper into uncomfortable territories. Truly, it's made me have, I've had people not be so kind to me for the things that I felt very convicted in my soul that God's been telling me. It's changed everything in how I view the body and how I want to help people.
So, you would say that like your perspective has changed.
100%.
Yeah.
And I know we've talked about it,
Mhm.
like your perspective of even medicine and how they do medicine and
Yeah.
how, I don't want to get too, um, I don't know. I guess it doesn't matter.
Yep.
We should just be honest. How many vaccines they give in the amount of time that they give them. Like you taught me something, like we're
Mhm.
not even making antibodies until we're 12 months old,
Mhm.
right?
Yeah.
Right.
Mhm.
So there's just a different perspective. And so tell us more about how your perspective has changed.
And like you were saying, like even breast milk can counter like what vaccines and things like that can do. I just want parents to feel like they have a choice in the matter and know their options aren't just like this black and white. It's not linear. There's so much more to this. But my perspective has changed that like we need to stop just treating symptoms and actually look for the root of the cause, a root of the issue, and really start helping people in that way. And I obviously was gearing like for a while we've been doing adult things in that regard. So now knowing that there's a lot of kids similar to Gianna, that's changed how I look at medicine in itself. Like, even with autism in itself, that is looked at as a behavioral disorder and there's no therapies of no one was telling me, "Oh, hey, look at her gut or look at this." It was put her in speech and OT and that's that. And so even when it comes to just that, even when I look in aesthetics in itself, I'm like, okay, what's going on with this person's gut that they're like, my skin's off, or I feel this way, I feel really off. There, it's almost like seeing people 3D now. If
Mhm.
it's like, well, there's more going on here. If I
Yep.
just give you one service, I'm just band-aiding it. Like it's a multi-layered
Yeah.
approach to everything.
Yes. And that's exactly like, and it's funny, it's like when we all started working together, we hadn't even completely developed the depth of
Mhm.
knowledge that we were gonna go. Cause like
Right.
when I stopped cycling and ovulating, like
Mhm.
what happened? My OB was like, well, you can go on Clomid. And I understand that,
Yeah.
but why? So like getting to the root cause of why all these things are happening. And so for me, my perspective changed on medicine even younger, I guess, like
Mhm.
realizing like they just wanted to put me on Accutane. Well, why do I have the acne?
Mhm.
We segment every organ
Mhm.
system, every system in this
Mhm.
in this country,
Mhm.
and looking at it from a full spectrum, full circle approach is the best way to go about it. And I think that's
Yeah.
where Gianna's story plays a role in your story and
Yeah.
how you're going to help people.
Yeah. I mean, everything works synergistically, and we instead of just saying, well, it's just that like there's a gut brain axis here that we need to talk about. And no one was talking to me about that or any doctor that we met with. It was like me constantly having to fight for like, well, what should we be doing? And it was no answer,
Yeah.
you know?
Mine was like when I was 36 and I went to my primary doctor and I just told him I was off. Like I had no drive, I had no motivation. I was eating right, I was exercising, I was doing all this stuff. I just knew that something had changed,
Mhm.
and there's no amount of pre-workouts or anything out there to do it. And I just wanted my blood work checked. I wanted my testosterone checked.
Mhm.
And he just looked at me and said, "You're fine." And I'm like, how do you just look at someone and tell me my test levels are fine?
No, like he
Or
literally just looked at you.
that's all he said. He just let, well, now granted, I was in shape,
It's med school.
you know, yeah, I was in shape. I get that, but that does just because you're in shape doesn't mean, and as we've seen with blood panels,
Mhm.
doesn't mean things aren't off on the inside. And that's exactly what was off. And then, I ended up getting my blood work done and my test. It's like 275. It was in the
Mhm.
tank.
Mhm.
But I could feel it. And I was trying to give him the symptoms of what I was feeling. But,
Mhm.
he was just stuck in that old school model. And
Mhm.
he just said, you're fine just by looking at me. And I'm like, well, if you're that good of a doctor, you should have a line out the door fixing people. But that's not the case. So, that was my kind of wake up because I was told, I was working with people nutritionally and with exercise. And that was kind of my wake up of like, there's way more
Mhm.
to this.
Yeah.
And I was really eager to dive in and learn about it too.
Well, it's layered and it's multifaceted. And so I think as we evolve as humans,
Mm.
we're lucky enough to be able to be in this space that we can also have like a role in how it evolves.
Yeah.
Mhm.
Like you, aesthetics was a big thing for me because of my own journey, my own
Mhm.
insecurities, my own acne. And then it is so rewarding to know that you can have an immediate output from the work that you do. Like
Right.
it's immediate reward. You can immediately fix something. But then as you start to realize and change or feel different or have something happen,
Mhm.
it starts to make you realize that other people have these stories too. So now
Yep.
it's like the reward that we can get from the medicine component
And
is even more amplified than the
mhm.
aesthetics.
Right. Even though it doesn't it's not the quick fix.
Right.
Mhm.
Because like with aesthetics,
Yes.
they can walk. It's kind of
Right.
like stretching, right?
Right.
I can stretch you and you immediately feel better, right?
Mhm.
But it's like working out. You can work out for months and you really don't get the same
Right.
result you want. So, but yeah, the aesthetics versus the medicine is a great analogy on that because with medicine, it takes time.
Mhm.
You got to go slow. You don't want to go right through it because you got to work backwards. But yeah, go slow and then work towards patient outcome that you're looking for,
Mhm.
and of course, getting the right blood work that you're looking for too.
Well, and I think what's also hard is, we have conversations like we were talking about it yesterday, and there was a patient that we were discussing that will only kind of be able to do parts of the plan
Mhm.
because a lot of all of what we do basically except for like 2% is covered by insurance.
Right.
So not everybody has access to these things, and that's what I hope eventually in our lifetime that
Yeah.
we see the changes with that.
Mhm.
Right.
That we see that, people are going to be able, people of all kinds, of all demographics, of all, financial status can have these resources because it is changing. And who knows if it's the chicken or the egg with the food, with the vaccines, with the EMF, whatever.
Right.
There's just a lot that's coming at people every day. And it's hard to navigate, not only as
Mhm.
providers, but also patients,
Yeah.
you know?
Yeah.
And I even applaud you and Tori for what you've done. You really saw it outside the medical model of
Yeah.
what it was. And I know that you guys have been tested with people saying, why would you do that
Right.
and do that stuff? But you went down that road anyway
Mhm.
because you trusted your gut and you knew it was right.
For sure.
And we know that the outcome is benefiting. So, one, I applaud you guys for that. I applaud you too for the wherewithal to pull. You leaned into each other.
Mhm.
Where sometimes that will separate a couple, and you guys have really leaned into each other. You guys, I see it pour everything into each other, but also into her. So,
Mhm.
I really applaud you guys for doing that and having the courage to seek outside the normal medical model. And like you said, let's get to the root cause here. Let's
Mhm.
start there
Yeah.
instead of just chasing these symptoms.
Yep.
And if we can get to the root, maybe we can have a little bit better idea of how we can kind of reverse engineer it, per se, if you want to use that, and look at and what steps can we do to now create a better outcome.
Yes.
Yeah, like for example, like if we were to ever be blessed with a child, we already know, we're lucky enough to know that we have MTHFR, which is a
Mhm.
genetic mutation that could
Right.
put people at risk.
Mhm.
But there's other testing that I would do because of
Yeah.
you and your story.
Yeah.
So we've alluded to the fact that we'll be opening up another part of the practice
Mhm.
and you'll be the lead person with the pediatrics.
Mhm.
What does your vision look like in regards to that?
So I want to bring on things that I've been doing to help Gianna in her journey that I also see I'm in a lot of like autism groups, on social media, and a lot of parents I can tell are searching for answers and their doctors are kind of like stopping them or making them feel unsure about the questions, and I want to be that source for them that can dig deeper. So there's certain tests that I want to be able to provide, just like for example, like a frat test, which is a folate receptor antibody test. I didn't know anything necessarily about that until we started learning that I have the MTHFR, Tori has it, and what that really means and does to the body is not once when I was pregnant or had Gianna had anyone brought this up. It was through you and Precision that I was like, okay, this is making sense. Everything comes down to methylation, and if my daughter can't methylate properly, she can't detox properly, what's going on in her body? And I think that people need to know about this and they need
Yes.
to have the source of someone that can order these things and tell them what's going on and then do the next step to help them. And so I am really excited to one, help supplement kids better, looking in their gut, looking at their methylation process.
Well, and if you don't mind, I
Mhm.
mean, the thing about methylation,
Mhm.
when you are unable to methylate properly, and
Mhm.
all three of us are sitting here and they want to say 60% of us have MTHFR.
Mhm.
I can tell you from all the labs that we've pulled in our small little test group, what you want to call it, it's
Yeah.
like 90%.
Yes.
Yep.
Mhm.
But you have to have glutathione.
Yes.
And glutathione helps your brain detox.
Mhm.
And I do believe that there's a direct pathway to glutathione deficiency.
Mhm.
And then you did have a harder pregnancy
Yeah.
and you were told it's safe to take Tylenol.
Yeah.
And there's it's
Well,
a
there's a
huge
big
thing.
It's a com
controversy about that right now.
I mean, right when we had her and all of this started coming out, I was taking the max dose and they were like, "It's safe, it's safe, it's safe." I didn't understand how much Tylenol depletes glutathione in the body, so not only am I depleting mine, I'm affecting my daughter's ability. Then she comes out of the womb and she gets all these things and fever spike, and I give her Tylenol.
Oh, jeez.
So then that depletes glutathione again. And what does that do? Then increases glutamate in the brain. So her body and her neurons really took a beating, honestly.
Well, and that's the thing that's I think that like now because you went through this,
Mhm.
turning it into a blessing because
Mhm.
Gianna is making progress and it's
Yes.
so cool to see. Like
Hmm.
Mhm.
you can see it in her face and her eyes and everything, and it gives me goosebumps. But like these are
Mhm.
things like it's just it's so hard
Yeah.
to know what to do, not to do. And as somebody that's only watched people get pregnant
Mhm.
and already knowing like gosh, like how much of a nervous wreck I am, and
Mhm.
you think through everything, it's like how do you know, okay, this is right, this is wrong? How do you even know just how to be safe? Or
Right.
can you equip them with
Mhm.
N-acetylcysteine, which
Mhm.
is what combats,
Yep.
Tylenol, it's the precursor to glutathione. There's like so many things. And that's the thing that I think needs to happen
Yeah.
because these are these simple little tests that people can do when their daughter or child is in
Mhm.
utero,
Yep.
before they have
Mhm.
babies, right when the babies are born. We
Right.
can test them for these things because MTHFR can cause a whole slew of issues
Yes.
from cancer to mental health issues,
Strokes.
everything. So
Mhm.
it depends on how it's expressing in your body.
Mhm.
We didn't know these
Hmm.
things.
Nope.
It's
And they don't teach it
crazy.
in school either.
You
And it's,
know.
I even had read something at one point like, if you're going to hire a dietitian or a trainer, and they look like their doctor.
Mhm.
Like, would you still hire them? Because majority of people wouldn't hire their doctor to train them, but they're the ones giving the advice and telling you what you're,
Mhm.
if you're not within that medical model, then like you don't know what you're doing, even though you both are healthcare professionals.
Mhm. Mhm.
Like you're just doing it in a different way. And because you don't fit their model, then they think you're unsafe or you don't know what you're doing and doing everything. But yet, like I said, if you guys, someone went to you two and looked at you like,
Mhm.
you guys look like you know what you're talking about because you're both in shape and take really good care of yourself.
Mhm.
Yeah, but it wasn't always that way for me. I was overweight with acne
Oh, you're
and
welcome.
generalized anxiety disorder.
Right, but
Still have the anxiety.
but also with the MTHFR, I was on a prenatal that had folic acid and my body could not break it down. And
Right.
so I was really severely postpartum depressed, more than I was willing to admit. But no one said that to me. Like, no one said, your body's not getting these micronutrients. Like, you're struggling. Like, it's just so interesting.
Well, you bring something up that's interesting that I don't think that I just kind of learned as well.
Mhm.
Like, so the frat test also
Mhm.
relates to MTHFR. It's about how much folic acid they're absorbing, people
Mhm.
are absorbing or getting, because it's really important for your
Mm.
Mhm.
neuronal activity,
Yeah.
is what I'm trying to say.
Mhm.
They fortified cereal with folic acid,
Right.
and people with MTHFR cannot absorb regular
Mhm.
folic acid. It's actually
Right.
toxic to us.
Mhm.
Right.
So it's like, it's just,
Yeah.
when did it all start? And I don't know,
Right.
Right.
the meeting, that's for another
They can
talk.
get like so far down a rabbit hole.
Yeah.
But it's not like you think you're doing the right thing and you don't
Right.
necessarily know. And to your
Yes.
point, like you can take a prenatal. Somebody's like, oh, I'm taking this prenatal if they don't know that they
Mhm.
have MTHFR. And what's even most concerning is
Mhm.
it's not covered by insurance to test it.
Mhm.
We found ways around. Thank
Yes.
God we have the medical director that we do,
Yes.
Dr. Rodriguez, because
Mhm.
she's like minded,
Amazing.
because we need her to help collaborate on these
Yeah.
things and believe
Correct.
in the mission that we're doing.
Well, and I also want to say, like, I am traditional. Like, what I mean is, I was trained very traditionally and I was hardcore, follow the rules, follow the book, do all the things. It wasn't until everything happened that it changed my life. And once that veil drops, you can't see differently. It
Mhm.
changes everything.
And we've talked about it before. It's not that we're against medicine, but it just isn't the first line of defense in a lot of cases.
Mhm.
And we can look at it and say that it's frustrating now that we know that there's these testing like the frat test. We know that there's genetic testing that can tell you the best medi. We
Mhm.
can be like, well, that's what we're here for right now.
Mhm.
That's our message that we're trying to get out. That
Yes.
like, look, like we can be mad that knowing that they don't do this stuff, but we're here to let people know that these tests are out there and you can get them done and you
Yes.
can be preventative.
Mhm.
That's why I call it preventative health.
Yep.
You know,
Well, and for our practice, for those that do have HSA and FSA, we can take that. We're working on ways to figure out how we
Mhm.
can make sure that we help everybody.
Mhm.
And so, with that being said, what do you wish more providers and parents understood about supporting kids with autism?
I think just being able to be like more patient and understanding in that process, because I always told Tori this, that I almost want to wear like a shirt when I'm out that says I'm an autism mom or something, because you get looks, I just want people to be more empathetic and more understanding and know that there's a lot more kids now like Gigi than there
Mhm.
ever were in my, like, growing up in lifetime. And so I want us to work harder and fight harder for these kids. They deserve it. A lot of them cannot speak. They need our voices. So I think if more people just started wanting to dig deeper instead of saying, this is it, like, this is your path, this is all you have, I think we'll have a much better outcome for these kids.
Yeah.
Yeah, and I mean, even looking into it, I think it's just we've all tried to like
Mhm.
not only segment with medicine, but segment people,
Mhm.
segment a diagnosis. Like
Mhm.
say, okay, well, you have bipolar disorder
Yeah.
or you have generalized anxiety,
Mhm.
and like you said in the beginning, treating the symptoms, not the cause. Well, why?
Yeah.
Maybe it's their microbiome's off. Maybe
Mhm.
it's that they're not getting methylated
Yes.
B12 and
Mhm.
folic acid.
Mhm.
There's all these little variables that are just micro shifts.
Yes.
Back to aesthetics, it's 1 to 2 millimeter shifts.
Yep.
Everything in your life, it's just 1 to 2 millimeter shifts, and just learning and repeating it,
Mhm.
and or like
Yes.
reorienting and all
Mhm.
of that.
Yeah, I think it's just like anything. Maybe they always had their gut microbiome was off,
Mhm.
and just over time, it just got worse and worse and
Yes.
worse until finally it was so severe that
Mhm.
they notice it. It's kind of like I've said it before, like a heart attack isn't the first sign, it's the last sign.
Mhm.
Yeah.
There are other things going on prior to that, and whether or not they ignored the symptoms and never went to the doctor, or whether the doctor didn't fully listen to the symptoms and didn't pull testing that could have prevented it. But once you get to that point, that is the end symptom. So,
Well, and it's being aware. Like the client that you had along before we even opened Precision, he went and they were training, and any time that this patient got to legs, the guy was winded. He could not make it through.
Mhm.
Jamie's like, something is wrong. You need to go to your doctor.
Yeah.
The guy called him from the. He went to the cardiologist, and he was immediately into surgery.
Really?
Yeah.
so he goes, I'm on my way to the surgery center. They're going to do it. I talked about it.
Sure.
It's
Yeah.
4 stents.
Wow.
So you go back to his family history.
Wow.
Yeah, you go back to his family history. His dad, his dad's dad, and his dad all died before he was 50.
And I bet
Mm.
no one checked an ApoB or lipo. You know what
Yeah.
I'm saying?
Yeah.
Like, why would you not do? I always tell patients your body whispers before it screams, and it
I like
gets
that.
yes, it really does. It's like it gives you signals, and then it's like, like
Yeah.
hello.
And that's what it was. It's just like, I'm like, this is weird. Like, we
Yeah.
can get through a whole upper body,
Yeah.
but just body weight. Like, I wasn't even using heavy equipment. It was just body weight squats was the first one. The second time he came back 2 days later was body weight lunges.
Yeah.
And I'm like, there is something wrong
Right.
here.
Thank God he had you though, because a lot of people are just like, yeah, I don't know, you
Well,
know.
Really.
well, because I'm sitting there thinking like, well, why is it the legs? And I'm like, well, legs,
Yeah.
require the most amount of oxygen, the most amount of blood, everything
Yep.
else. Well, if it's a blood and oxygen issue,
Mhm.
what's the pumper?
Right.
The
Right.
heart.
What's going on?
Well, so that,
Yeah.
then again, I'm thinking, I'm hearing the symptoms. I'm like, well, what's the cause?
Right.
I'm not those like, let's figure out
Mhm.
what's the cause of this? So I went immediately to the heart, and yeah, I mean, a couple of days later, he was in and had 4 stents put in.
That was very
He's a
intuitive. Yeah,
walking
I don't
heart.
even know if I would have thought about that. You know.
Yeah.
Yeah, but his doctor said he was just a walking time bomb. It's just a
Yeah.
matter of time.
Mm.
Well, and that's just it. It's taking every patient's story, but then also our own story. Like if I think back to my body whispering, before at first it was COVID that made my body
Yeah.
shut down. But if I look and I pay attention, there were so many little variables that it was trying to tell me.
Right.
Like when I started having, the heart
Right,
palpitations or,
right.
Mhm.
couldn't sleep. There was all these little things and I just
Mm.
kept ignoring it.
Yeah.
Because it's like, no, we must go
Mhm.
on. We must keep doing it. And so it's then taking that drive, the hunger that you had to
Mhm.
drive from Champagne.
Yeah.
You have that heart in you,
Mhm.
and now
Yeah.
it's like, now you have a huge reason why.
Yeah.
So at the end of the day, everything comes back to your why.
Mhm.
What is your why as both an NP and a mom?
I think obviously I always want you go into nursing. I know your journey's a little different, but you go into nursing wanting to help people and you wanted to help them feel beautiful. And I always knew I wanted to help somebody and be like a source of light for them. And I always say God's really funny because he'll always circle it back to you.
Mhm.
And I never knew that that would circle back to what I had to be for my daughter. Cause like I said, you vision your family and it's going to go this way. And my why is now just to really help people from the root issue out and whatever that means if I give them something that they weren't getting somewhere else. That is life changing.
You're an
Right.
advocate.
Yeah.
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 And so with that, if somebody is listening that is having a similar situation
Mhm.
or, their parent or a nurse or whatever,
Yeah.
what message do you want to leave them with?
Yeah. I think one, even if you're just wanting to break into aesthetics or functional medicine, don't give up. If that is your dream, and drive the hours to get somebody that you trust that's going to help guide you because I've always told you this, like, and you told me there's no, coincidences or, it always,
Mhm.
it's meant to be. God knows what he's doing when he aligns us with people. And so keep pushing, find the right people that will give you the support. And as a parent, this journey is extremely isolating. Tori and I will often talk about it, but you're not alone. There's a lot of people out there that care and love you. And I want people to know that if you feel that way, like, I can empathize with the situation.
Mhm.
I can be that provider for them, for their journey, for their kids' journey, to find things to help improve their life. I know people get really heated when I say the word healing, but I mean improving from the state that they're in. So that's healing, no matter what that looks like, whether that fully pulls Gianna up out of the severity that she's in or just moves her a little bit more, that's still healing.
100%.
100%.
Yeah.
Yeah, absolutely.
Yeah.
I wholeheartedly agree. And it's funny that people get triggered by that.
Mhm.
They need their own healing. You know what I mean? Like,
I
honestly,
know.
because it's healing is mind, body, spirit.
Yes.
And, there, we don't really know the why things happen to us,
Mm.
like what our deck of cards is about, but then utilizing everything. And that's what's so admirable to you,
Mhm.
you know, and also as business owners, like we also know that you can't teach hungry and motivated and
Right.
passionate. You just can't.
No,
Can bring it out of someone, but I can't give it,
right.
give it to them.
And
Right.
you've just always been that. And I think that fight within you, you are always equipped to deal with this.
Yeah,
Mhm.
And, you know, I'm excited to see what happens.
I'm really excited too. And I last Sunday or just this past Sunday, there was a message and it was, I used to think, I still question like, God, because I'm very sensitive. So I'm like, God, like, are you sure you gave me this task? But it's not, he's no matter what, we can't control some of the things that like man has caused or done. And, but he's going to use a situation to
Yep.
help others. And I, I loved that message. I was like,
That's beautiful.
yeah,
It's a great one.
It really is. Cause yeah, we can't control sometimes what even like if you even want to call it the devil, like
yeah,
whatever it
yeah.
is, you know, but we can control how we use it.
Mhm.
Right.
Yeah.
Right.
Well,
All right. Well, that concludes another episode of Younger by the Minute. I'm Jamie Spicer. I'm out.
and thank you, Rachel, for being on.
Guys.
We're so excited. This is the first of many.
Yeah.
So stay tuned. If you have any questions, we'll have all of Rachel's information up there. You can find her also at Precision with us. And thank you for listening. What do you